And this is a live version today of Anastasia's Hump Day Happenings. Why is HPV scarier than dating Taylor Swift? April is Oral Cancer Awareness Month. There's still a disconnect in how important your dental professional plays a role in screening for that. And there's also a disconnect in whether or not you, the consumer, or our patients actually know that you are getting an oral cancer screening. Reason number one, never ever getting back together. First of all, I love her songs, but these are just like such cool song titles. I had to play along with this. Even though your relationship may have ended, being you're never ever getting back together, I got news for you. This virus, HPV virus, it's an STD. That virus could be lasting in your system for up to 2 years. Now, the strain that's actually stubborn is strain 1618. Men, you are at a higher prevalence to get HPV related cancer than women. Okay, so how do you get it? You get it skin to skin contact. HPV is a sexually transmitted disease, meaning skin to skin contact, oral sex, intercourse, lifestyle factors, and in adding a risk on top of that, smoking and alcohol. Vaccines came out for the younger kids, being boys and girls ages 11 to 14. The thought behind getting the vaccine is because you want to get this into the system before they're introduced to a virus. So HPV related, 50% are tonsillar cancer cases. A lot of HPV related oral cancers are going to be in your tonsil area, your soft palate, the back of your throat, the base of your tongue. HPV is also the cause for 28 to 35% of oral pharyngeal cancers. All right, so number two, why is HPV scarier than dating Taylor Swift? Shake it off. Shake it off. You can't shake this off. It's a virus. It's in your system, so you can't shake it off. Knowing the risks. Alcohol, smoking, family history. Know the location. Soft palate. So like 15% of your palate is your soft palate. You're going to be looking for either, it could be red, it could be white, it could be a mixed lesion. You're going to look for, it may have a start in a lump, and then it might look like a wart, kind of like a cauliflower. Know the symptoms. You're not going to be able to shake it off. Know the symptoms. Symptoms are sore throat, hoarseness of your voice. If it's lasting more than 2 weeks, there's something going on. Maybe even difficulty swallowing. And sometimes too, you might think, well, it's just me. It could be strep. It could be any strep throat. It could be anything like that. Earache. That's another thing, an earache. If you're listening, just type in yes or no. Has your dental hygienist or dentist provided an oral cancer screening? Statistics are saying that that patients don't feel they're getting this screen. It's a legal scope of practice, and we're responsible to do that. Number three, bringing it home. Because of bad blood, okay? Bad blood. Now I know I'm weaving this in, it's a stretch, but you gotta work with me on this. Bad blood between hygienists, dentists, and our patients, no one likes it, right? Hey, it's not as bad as United Airlines. Hey, we're not reaccommodating you. Let's talk about bad blood. There's no blood test for this. So it's not like you can say, hey, give me a blood test for HPV. There's not. If you have not been in to see your dentist or your dental hygienist, especially this month, please go in and make an appointment, because HPV, anything abnormal, oral cancer related, is as small as, and I'm going to quote you, Debbie, a grain of rice or a mustard seed. Do you know how tiny that is? It's so tiny. And I mean, why are we waiting? You don't want to have bad blood between a medical professional, dental professional, and yourself in something that could save your life. That's the reason why HPV is actually scarier than dating Taylor Swift, because even though you're never ever going to get back together, it's a virus. You got to know that. You got to know that your lifestyle, when you become sexually active, and yes, it is a sexually transmitted disease, how that affects you. Number two, shake it off. You're not going to shake it off, but you need to know, okay, how long can it live in my body? What are the symptoms? What are the locations? And who can help identify this for me? Where do I go from here? Then three, bad blood. You don't want to have bad blood between your hygienist and your dentist or any other medical professional. Till next Wednesday, take what you learn and make a difference with it.